Welcome to the Kim B. Davis Show. Here we'll talk to the leaders in technology, culture, business, and the arts. We'll cover politics, advocacy, motherhood, writing, mental health, and mostly we'll focus on hope. Join Kim B. Davis, author, playwright, radio personality, event consultant, professional speaker on the Kim B. Davis Show.
Good evening and welcome to the Kim B. Davis Show. I'm your host, Kim B. Davis, and this evening we have another dynamo here. We have Mr. Eric Foster. He is the National Policy Director for Minorities for Medical Marijuana for Cannabis and Hemp Policy. He is also the Group Director for Strategy at Banks and Company. And this evening we're going to be talking about medical marijuana and the cannabis industry. Good evening, Eric Foster. How are you?
I'm good, Kim. How are you doing?
I'm great. So thank you for being on the show today. Hopefully you can break this fascinating topic down. So cannabis, marijuana, do we call it weed, has been a contentious subject in the last few years, where it seems like there has been this explosion of growth where you see retail establishments on almost every corner, all across the Metro Detroit region, and lots of people are getting into it. However, a lot of people are concerned because they're like, well, wait a minute, marijuana used to be illegal, but now because we have voted to legalize it, we have made it profitable for some people. So would you tell us what the difference is between, and forgive me if I'm not saying this correctly, recreational versus medical marijuana? What is the difference?
All right. Well, thank you, Kim. So a lot to unpack. So I hope that your listeners and viewers are ready to go for a little bit of a trip, because we're going to walk through where we are now, because there is a tremendous amount of misinformation plus confusion about how this whole thing works. And the way I phrase this is the commercial marijuana industry, the commercial marijuana sector. I don't use cannabis, even though cannabis is the preferred term for a lot inside of the industry. They're both interchangeable. Marijuana as a term was introduced to provide derogatory connotation to the usage of marijuana and to who were subscribed as the users in the 1920s and 30s when the war against marijuana started. That being said, and as well as hemp too, because hemp, the cousin of marijuana, which is now legal due to the 2018 Farm Bill, a lot is a product that wasn't just used for medicinal purposes or for food, CBD, and other purposes. It was also used as a commercial material for construction, for other commercial applications. It has a tendency that's stronger in some instances than concrete and is more durable than plastic. So that's the hemp cousin, but we could do something on the cousin at a later date. Getting back to the main member of the family that we're talking about. So starting in roughly 1996 in California, when California passed a voter initiative to allow for individual use for medical purposes and to start a commercial medical sector, first starting with caregivers, transitioning then through state statutory law to set up an actual infrastructure for commercial licensing, regulation, testing, compliance standards for different licensees within the supply chain, as well as different rules for interaction within the supply chain, allowing communities to decide to opt in or opt out, to control the zoning for where the commercial businesses will go, as well as how to handle the residential use. Then a ballot initiative out there that moved them to add recreational or adult use marijuana. That was the nexus, the beginning point. Since then, now we are at 38 states who have legal, commercial, medical, and or recreational marijuana. 19 have both,
Mhm.
and the other 19 don't. That being said, and there's initiatives to try to get some of those 19 to adult use recreational. There have been some starts and stops with some of that. But that being said, that's where we stand today. So it's still illegal at a federal level. That is correct.
Mhm.
2014, congressman from California, actually two congresspeople, one from California and I believe one from Indiana,
Mhm.
Far Warbacher from California, and Far, who I believe was a Democrat from Indiana at the time. They passed a amendment to an appropriations bill, the Far Warbacher Amendment, which basically was a backdoor legal codification of states that had voted to allow for medical marijuana for both the commercial production and regulation, but then also for personal use related to health ailments.
Mhm.
That has continued to be upheld in every appropriations bill and continuing resolution bill for budgetary purposes on the congressional level. Now, the recreational part technically isn't covered because they've tried to in the past two Congresses to add that in the appropriation bills, but it hasn't gotten through. If that part might get through this year, but it's a backdoor. It basically says that the Department of Justice cannot use any of its resources to go in and enforce federal laws in states that have voted to allow commercial or individual use of marijuana. So that coupled with the 10th Amendment and the Article 4 of the Constitution, which governs states and then govern the concept of federalism for states to be able to create any laws that haven't been granted by the federal government, has created this 38 state system where you have different laws and different structures of regulation. You have some structures where the state controls everything, like in Florida. They
Mhm.
control what cities you can place it in. They control the zoning within those cities. They control all of the decision-making process. Two states like Michigan and California, Colorado, and Massachusetts, which are decentralized, uncapped local control states, where the state doesn't have a cap. It's more of a compliance regulatory model at the state level, but local communities have significant input to decide whether they're going to allow or disallow businesses in their community. They can't prevent people individually for using, but that's the case. So now, dovetailing that back to medical versus recreation.
Mhm.
So here's the jump off point. There really is a difference in this context. So testing rules, depending upon states, are pretty much the same.
Mhm.
The states that have medical research, where they've codified it in state law through their medical programming, like Massachusetts, Pennsylvania, Maryland, Connecticut, and others, they're doing extensive actual research. I see that we just gave out grants here in Michigan because there was something put in to the recreational law that was passed to do research on PTSD. That's real limited.
Mhm.
We've actually at Banks and Company and the Infra have been jointly pushing for a Michigan Medical Marijuana Research Act, modeled kind of off of what Pennsylvania and Connecticut has to do research, but I'll get back to that later.
Mhm.
So the medical side is tied to usage relating to a qualifying medical condition. And in Michigan, we've got 34.
Okay.
And you have to have first a doctor, your regular primary care physician or specialist that documents what your qualifying health condition is.
Mhm.
Then a second doctor who in effect writes a prescription, if you will, for you to be able to be eligible to apply for a medical marijuana card. You apply to the state for that card, and then you can get and purchase medical marijuana from a medical facility, or you could even purchase at a recreational retail facility. The recreational side is individual adult use. So if you're over the age of, and in Michigan, when the law was initially passed, the language stated 21, but I think there's been some modification to where it's 18, but that's a little gray. I've got to dig a little bit more into that. But if you're an adult with a valid driver's license, you can go into a recreational store and purchase marijuana. Now, you can't go into a medical retail store and purchase anything, because a medical retail store can only service patients with medical marijuana cards. But if you're a recreational facility, can service both medical patients and regular individual use customers. And that's the difference. You can, each person in each category can have up to 12 plants on their own that they can grow for themselves. One other difference in the medical side, we have what's called caregivers, which is a model where a person, let's say you were a caregiver, registered with the state. It's not a license, it's just a registry. You have then the ability to get up to 5 other people, so me and 4 other people, to be your patients, and you're growing 12 plants for each of us to then turn into edibles or flower product for us to use. So taking the long journey back to what the difference is, and why I think it's important is because this is a commercial industry. And so I think a lot of people have tended to think that, well, now that it's legal, can we just do stuff?
Right.
And you've known me long enough, because we go back to when I was a young, spry child in my early 20s and hanging out at Detroit Regional Chamber events.
Yes.
When I was at the Wellness Plan. Or I've always been the point that, yeah, you can't just do stuff. There's got to be some sort of process and procedure for why we're here and what we're doing. And this industry is no different. So hopefully today we can get into a little bit and give folks a little bit of context on that and why that's important, because that is important. But then how can Black and brown people still participate despite the regulatory structure that exists?
Exactly. You're asking my next question. See, Eric, I knew you were the expert and the right person for the job. So you've given us a lot of information. So I just want to backtrack a little bit. So it sounds like a lot of states on the East Coast are heavy into research, while the Midwest is sort of still working to get there. You have 34 unique medical conditions in Michigan, which you can apply for. And there are different levels at which you can apply for either for a medical, would you say a medical license to purchase?
Medical marijuana card.
Yes, medical marijuana card, excuse me, thank you. To be able to utilize that service. Now, having said all of that, because you just talked about how are Black and brown people able to do that, talk to us a little bit about how you in your role are able to advocate for Black and brown people, because what I see in Metro Detroit is not a lot of Black and brown operators. I see a lot of other people that are capitalizing on this industry. And I get it, it's an industry, and I agree with you. You should not be able to do everything. And this is confusing to me because as someone who's not into this particular industry, I don't quite understand it. I understand there are commercial uses for it. I understand there are medicinal uses for it. And I also understand there are, as you said, hemp, was it hemp, is stronger than plastic and even more durable.
More durable than plastic and stronger than concrete.
So I have heard that before, and I'll tell you who I heard it from. Woody Harrelson, the actor, has long touted the specific I guess, physical components of it, that it could be used as a new type of a material. And he talked about it being in clothing. He talks about it in certain types of medicines where you're talking about hemp. And so it is fascinating and it is confusing because there are all these different terms. But I do want to be able to bring all of this together so that we can educate people so that people understand. But tell us how you advocate for Black and Brown people. And what is, in addition to that, what is the biggest obstacle for Black and Brown people getting into this industry?
Well, thank you, Kim, for that. So my role both at Minorities for Medical Marijuana, I was brought on earlier this year. Now, Banks and Company, and I came on board with Banks and Company back, this was my second stint, and I came on back in 2018 to do work. We were doing consulting in this particular industry sector, but it was more so Detroit-based, based on people that were dealing with the Board of Zoning Appeals and zoning related matters. So not to the degree that we do now. And so one of the first organizations that I did research on and reached out to was Minorities for Medical Marijuana. And so I convinced Lloyd, Lloyd Banks, our CEO, I convinced him we need to join this organization because it is a minority trade association that is focused, even though the title says medical marijuana, Minorities for Medical Marijuana is active in advocacy and support, servicing, and structuring for people in the commercial medical, commercial recreational, and commercial hemp, as well as advocating for usage, access rights, social justice, and other components for individuals in the industry, and they can benefit from the industry. So we've been an active partner, and actually last year, their new Michigan chapter president, she's now a year and a half into the role, Simone Kason, who's my partner, 50 Grand, we do a monthly podcast called Cash Out on Cannabis. We started doing that last year. We started doing some educational events. Banks and Company, we have been doing educational events, not just on behalf of our clients and lobbying communities to consider the opt-in and how they can structure their ordinance, but in other communities, just to help people understand what were the opportunities and perspectives within the industry. So then they asked me to come on board this year in a role working with them, in addition to Banks and Company, to help bring the focus of what one of my skill sets is, which is public policy, understanding statutory law, administrative rules, the appropriations process, and writing the language that can be implemented in all of those different factors to then carve out how we would address things on a national level, both federally and then within those 38 states and the other states where people were trying to get it there. Now, how does that tie into trying to get Black and Brown people into the industry? So Michigan, surprisingly, is one of the 4 states with the highest concentration of Black and non-white owners, percentage-wise, in the country. California's number 1, Massachusetts is number 2, Colorado's number 3, Michigan is number 4. One of the reasons why is because all of our states are uncapped local control markets. So in that structure, while the state is a supporter of trying to get diversity in ownership, it's also not a picker of who gets licensing in terms of states like Florida, Pennsylvania, Ohio, and other states, Illinois and the like, where they pick the winners and losers, if you will, at the state level. And even though those states and others have written in the whole term of social equity into their licensing process, they've all failed at getting diversity in the ownership class. That being said, so the first thing is to have a market where, at least at the state level, the state is more of a compliance partner and can help bring resources and structure and rules, but not picking who gets and who doesn't.
Mhm.
Then the next step is within that local control. So in that local control, one of the things that we've been able to creatively do over the past few years with communities is to build in how in their ordinance they can do preferencing and economic development and community benefit type modeling for licensing that doesn't run afoul of the dormant commerce laws, which is what communities like Detroit, the city of Portland, Maine, the state of Maine, Missouri, Illinois, not Illinois, yeah, not so much Illinois, but Ohio
Mhm.
have all run into as a problem in terms of their laws that had preferencing, but had preferencing written in such a blatant way that it crossed the line and was not defensible in court,
Mm.
unfortunately. So we found, how do you write it in such a way where the goal is to try to incentivize local participation, participation from people from various socioeconomic zip code classifications, as well as supplier diversity goals in procurement, and then the reporting as a part of your local renewal, hiring goals, quality of employment, community partnerships, good neighbor programs. And we've leveraged a lot off of the Zoning Enabling Act, which has specific sections, four core sections that relate to municipalities' abilities to create and govern within their zoning rules and regulations, standards for the economic well-being, public health, safety, and goodwill of their communities, coupled with Article 7 in the Michigan Constitution, which grants broad powers and interpretation of broad latitude to municipal governments inside of the state of Michigan. And you've got some similar dynamics to some of those other states as well. So you can then at the local level create that part of the licensing that tries to really push and encourage not only people of color to apply, but then also to get together to hopefully do some fairs and other things to try to educate folks. We at Banks and Company have done some free events with the city of Kalamazoo as an example, when they were trying to get people to learn about the industry to potentially apply. We didn't have a client in the game, but we came in and laid out the steps, the structure, what you needed, how it works, what they could put into their ordinance, which they put a lot of good things in their ordinance to try to get at not only the ownership piece, but how do you also spread the economics through hiring local vendors or socioeconomically disadvantaged vendors, through hiring from specific zip codes, transitional workers that have certain barriers to employment, community investment, having to do good neighbor plans and partnering with neighborhood organizations and tying your renewal at the local level to what you do in fulfilling those goals, because you write it as it's a voluntary plan that you're presenting as a part of your application, but if you're approved, then it becomes mandatory. It's one of the ways you stay inside the corners of the dormant commerce laws.
Mhm.
So in the communities we've worked with that have done that, they have either survived or haven't had those legal challenges that other communities have. Now, the next step is you got to actually have organizations and municipalities trying to work to get people like us to get into the industry. Just like you work with the chamber, what MMBDC does, now MMSDC tells you how old I am. What they do in terms of trying to educate people to become and group up together, because look guys, if you want to do this, but you got $25,000 in the bank, you can't do squat by yourself.
Right.
You need to partner with 10, 15 other folks. Your municipality, one of the things they should be doing, if they want to encourage and get that, is they should be partnering with minority business groups and organizations like Minorities for Medical Marijuana and other entities to try to hold informational forums to educate people. How do you form joint venture agreements? How do you structure that business entity? How do you get into the queue to apply? What does the application process look like? What are the requirements? What does the local application process look like? The opportunity is there, but it's education, it's structure, it's intentionality to say, we're going to try to clump together as many groups as we can, and then try to clump together intra-diversity groups. So if it's African American and Native American, if it's Asian American and Arab American, if it's Latino American, African American, and multiracial, doing those things as well so that you have that diversity of ownership. That's another critical component. It just won't magically happen. Now, one other thing that's taking place here is Simone, who I mentioned earlier. So she's working on creating a Michigan marijuana investment market.
Okay.
Per a law that was passed in 2014 that's been pretty much sitting on the shelf for creating individual, local, exempt stock exchange investment markets, where there is basically an entity becomes a broker dealer. They regulate, manage the market. It's managed and regulated as it relates to rules governed at the state level, but it's publicly traded inside of the state of Michigan. Companies apply to list themselves. They have to go through rigorous vetting, and then people can invest. But it allows for individuals to be non-accredited investment people to submit and buy shares of companies that are trading themselves on this exchange. And it lets Black and brown companies get on the exchange. There'll be white companies on there too, but it lets them get on the exchange to raise capital. Another thing that we've been working on, I was on the Racial Equity Advisory Work Group with the state. And one of the things that we pushed for in my particular committee, which was process and pathways, was to create 2 new taxing aspects within the law. Bring back the provisioning center sales excise tax of 3% and do an intra-licensee transaction tax of 1.5%, because Michigan is one of the states where the sales between the grower and the processor, or the processor hiring the secure transporter to move product, those aren't taxed. Other states, it is taxed. And so I put those in to do a couple things. One, to give local communities additional streams of revenue, because right now, unless you do recreational retail, you don't have, beyond property taxes and the $5,000 fee for the municipality. And in Detroit, Muskegon, Grand Rapids, those cities that have municipal income tax, where you can charge both the business and the employees, you're limited on new streams of revenue you can generate.
Okay.
So part of the goal is to create those streams for those local communities. But then another part of the goal is to fund dollars for for equity grant funding and opportunity funding to help fund businesses to get off the ground as well. So that's another leg, if you will, or stool in the chair to get people to the goal. So you've got the investment market, you've got something like that, additional taxes to generate additional dollars that can be utilized to put money in, and even some of those dollars can be used to fund research inside across all of the qualifying conditions, not just PTSD for veterans, but for all folks across the qualifying conditions with caveats built in for communities of color in terms of the medical research.
Mhm.
So those are some of the things that we're trying to work on here in Michigan, and then replicate those in other states. In my role, I've been working Nevada. I've worked on some things relating to their new consumption lounge licensing model, which is targeted towards social equity, diverse applicants. In Arizona, helped Arizona craft some rules in their new social equity licensing that really codified joint venture opportunities. So, coming from the industries we come from, we know joint ventures between minorities and corporate entities is the norm.
Mhm.
And we know that in that norm, you have the 51-49 or 55-45, but doing that into Arizona so that people of color have those real opportunities to be in partnerships that don't take advantage of them.
Mhm.
And then trying to do that in other states as well. So part of my role is national. So thinking about this nationally, and I've kind of drilled it down into 6 pillars of licensing and ownership,
Mhm.
of of supplier diversity and vendor procurement, of career mobility and workforce development, community investment and economic return, social justice, and health justice and medical research.
Mhm.
So those are the pillars of the overall M4MM policy platform that we work from and try to adopt those things within each state in pushing, but it's all with the intentionality of trying to make sure that we're creating a structure that will provide access for Black and Brown folks that will address more than just one narrow bucket of either a narrow license type
Mhm.
or a narrow bucket of a narrow lane of thinking. Supply diversity for ancillary businesses is critical.
Okay.
Employment and moving people up through the ranks in employment, making
Mhm.
sure that the employees have access to EEOC and discrimination protections and the like, making
Mhm.
sure that there's community investment and community benefits and good neighbor partnering that's required, that there's social justice beyond just expungement, so that expungement is just the first step of restoring the economic viability of that returning individual.
Mhm.
And lastly, the research, the health research, because even though I'm not a user of marijuana, I've seen through study and through direct testimony of people that those products do help health
Mhm.
ailments.
Mhm.
And if we can continue to do more study like those states that I mentioned, and
Mhm.
one of the difference between those 3 states and other states that do research like Washington, California, Colorado, that
Mhm.
do research as well. In those states I mentioned, Massachusetts, Pennsylvania, and Maryland and Connecticut, they're doing research in partnership between research universities and institutions, hospitals, and licensees.
Mhm.
So it gets licensees a stake in the game of research as well, which I think is a good model. I know I've talked a lot, I'm gonna stop
You gave us a lot of information, Eric. So you talked a lot about investment, having resources, understanding the rules and regulations of your municipality, understanding what type of medical marijuana license you'd like to have. So I want to ask a question about brick and mortar. Is this an automatic for this particular type of business, or is this something that can also be done online? And
So
we only have a few more minutes.
great question. So it's primarily brick and mortar. The
Okay.
retail component has a online for ordering, but there's no intra-mail transit.
Okay.
There is vehicle delivery. And in Michigan, you can't have vehicle delivery where in Massachusetts, you can actually get a delivery license
Mhm.
where your business is just basically being an Uber to the licensed retail stores. In Michigan, that's not the case. The licensed retail, medical, or recreational stores can request for the state to approve them to have delivery and have that as a part of their service. It's actually something else that we're going to work on lobbying on a little later this year around aviation for
Okay.
transportation. You've got secure transporters, but because of the reach of the state,
Mhm.
aviation as an additional way of transportation in addition to the traditional road transportation, as long as it's inside of Michigan. So working with the state on that.
Mhm.
But it has to be brick and mortar.
Okay.
It has to be brick and mortar. And it's only 268 of the 1,773 communities in Michigan who are allowing medical or recreational businesses, the brick and mortar,
Mhm.
to operate. There's also 3 cities that have opted out, but because they have tribal land,
Mhm.
and the Sioux tribe and a couple of other tribal nations have legislated legalizing commercial marijuana on their lands, they have given licenses to people on their lands in those municipalities.
Okay. Fascinating. Fascinating. Eric, we're going to have you come back because there's so many more questions that I have, but we have run out of time. You are truly the expert. Thank you for breaking all of this down for us. Tell us where we can reach you, and then give us one nugget of advice for anyone who is thinking about approaching this business.
So you can reach me a couple ways. You can reach me, like I said, I'm with Infra-MM, I'm with Banks and Company on a monthly basis. We do a podcast, Cash Out on Cannabis, on Mondays at 12 o'clock. First Monday of every month. We didn't do it this month. We'll be back next month.
Mhm.
You can also email me if you have questions, either at eric@m4mmunited.org or eric@bankscompany.us if you have questions. And a nugget for folks, I
Mhm.
would say would be this. This is an industry where there's no institutional barrier that says you can't get in. It's not like the automotive industry where the institutional players are so big, the cost of getting in is too big.
Mhm. Mhm.
But you have to do this smart. There are rules, and nobody's going to reduce the rules for you. That doesn't mean that you can't play in the game.
Excellent, Eric. Thank you so much for coming on the Kim B. Davis Show. I hope you'll join us again in the future so we can continue this fascinating conversation as this industry ebbs and flows and evolves over the next few years. It's an exciting time.
I will. I look forward to it. Yeah, I got a lot of information to give, and people need to know
Yes.
this information. We got to clean up all this false stuff out here in these streets, not just on this industry, but so many other places.
Mhm,
My
mhm.
God.
Thank you, Eric. Thank you guys for tuning into the Kim B. Davis Show. You know, I'm your host, Kim B. Davis. You can always find me on Facebook, Twitter, Instagram, LinkedIn, Snapchat, TikTok. Bachelor is spelled BATCHELOR. You can see this show on youtube.com/Kimberly Bachelor Davis. You can also hear this show on Apple, Spotify, Google, and Stitcher. You can find out more about me as an author at kimbdavis.com. Thank you guys for joining us. I hope you'll tune into the next episode. And as always, remember, be magnificent.